Now, Group A will then take notes and listen while Group B presents their argument.
The best counseling approach to use with substance misuse is behavioral therapy. Ivan Pavlov was a psychologist who demonstrated classical conditioning. A classic example of this is how a dog will salivate when shown food. There are a few different responses and stimuli that are associated with the conditioning. For example, when the dog salivates at the sight of food, this is an unconditional response because it happens naturally and automatically, and the trigger is referred to as an unconditioned stimulus. If the dog is triggered to salivate by an object other than the food, for example, the ringing of a bell, the bell is known as a conditioned stimulus, which then leads to a conditioned response. If, say, the bell is rung and the food is not presented, the dog will eventually no longer salivate at the ringing of the bell, and this is referred to as extinction. John Watson, a different psychologist, believed that phobias were this process of classic conditioning, starting with the fear being the response to a stimulus such as a snake or spider. Joseph Welp created a treatment procedure called systematic desensitization, which is a combination of relaxation training and a conditioned stimulus. In this process, the person confronts their fear, such as the snake or spider. Before classical conditioning, psychologist Edward Thorndike believed that behaviors were determined by its consequence, called operant conditioning or instrumental conditioning. An example of this would be when certain behaviors are rewarded or reinforced, a person will tend to repeat these behaviors due to the favorable reward. All of these bits and pieces of behavior therapy were first developed and put together in a consistent format by psychologist Burrhus Skinner. He made it clear that all behaviors are brought about by operant conditioning, and to change behavior requires the appropriate operant conditioning. After Skinner, psychologist Arnold Lazarus made the therapy popular in the 1950s, who emphasized the thoughts in behavior. Behavioral therapy is best suited for individuals who have substance misuse, phobias, OCD, sexual problems, habit disorders, and people who have issues with social skills. In behavior therapy, the goal is to reinforce desirable behaviors and eliminate unwanted or maladaptive ones. From personal experience, throughout clinical, I observed and witnessed the use of behavior therapy in a variety of situations, whether the healthcare providers knew they were using it or not. A few examples I observed while working in acute psych was when a patient would demonstrate good behavior, they were given a reward such as their clothing back rather than wearing pajamas, or hourly passes off the unit. Because the patient's good behavior was rewarded, they would continue to display these behaviors. Another example is from when I was observing in Psych Emerge, and a patient became loud and violent, leading to a code white. The patient was held down and given an injection to calm her due to her inappropriate behaviors. When that same patient was able to control her anger and outbursts, she was rewarded with a smoke pass and so on, reinforcing these good behaviors.
Behavioral therapy is the best approach to use during the treatment of addiction because it aligns with the method practiced by most treatment centers. Behavioral therapy is based on the premise that if an individual changes their behavior, then changes in their thoughts and emotions will soon follow. When an individual enters rehab or any facility, they are forced to automatically change their behavior. For example, it is policy that upon arrival, the individual must abstain from all substances, and in order to ensure that the individual abides by this rule, many facilities will test the urine of the individual every other day. Once the behavior of using drugs is changed, then the process of therapeutic collaboration can take place, where the individual and clinician can work towards changing unhealthy thought processes and negative emotions. From my own experience when I was struggling with addiction issues, what worked for me was entering a program that initially forced me to change my behavior. It was a program where I resided for over a year, and they tested my urine every second day. This program used contingency management as well as the reward for having a clean urine test meant being able to stay in a brand new 3-bedroom townhouse. I can tell you I did not have a positive urine test the whole time I was there, and as my behavior changed, so did my thinking. And with the help of counseling and intense programming that included all types of classes, ranging from gaining self-esteem to parenting to budgeting. From my experience as an RPN student during clinical on the psychiatric unit at KGH, I can say that behavioral therapy was used as it was policy that drugs and alcohol could not be used while admitted as a patient. If it was suspected that a patient had been using, their urine was tested, and in some cases patients lost past privileges. In addition, behavior change, as in the case when abstaining from drugs, was supported by having patients make up relapse prevention plans. I had the chance to collaborate with the patient on making up her relapse prevention plan. Drugs act as a primary reinforcer directly on the brain's reward system and learning processes, and underlie the acquisition and maintenance of drug-seeking behavior. Behaviorists believe that substance abuse is behavior reinforced by consequences such as how the substance makes you feel, or in my case, it made me lose weight. Fortunately, behavior is learned, which means it has the potential to be unlearned, meaning recovery is possible. Rather than blaming behavior on genetics and making people feel powerless, the behavioral approach enables and empowers people to take control of their life and regain the ability to function.
The best counseling approach of substance misuse is the behavioral therapy. Behavioral therapy is also sometimes referred to as behavioral modification because its basis lies in the assumption that a person's emotional problems, just like any other behavior, are actually nothing more than a learned response to their environment, and as such can be effectively unlearned. Behavior therapy is a great approach to use for substance misuse in patients because it focuses on the possibility of reversing the maladaptive behavior by restructuring of how one behaves, by adding strength to their very notion that recovery is possible. The person is constantly learning better ways to adapt, and the ultimate goal is to replace the destructive behavior of substance misuse with positive, beneficial behaviors. Therapists create treatment plans specifically tailored to individual conditions. Some exercises may include discussions about coping mechanisms, role-playing, breathing and relaxation methods, pause reinforcement, activities to promote focus, journal writing, social skills training, and modifications in response to anger, fear, and pain. Therapists sometimes ask patients to think about situations that scares them. The goal is not to frighten them, but to help them develop different coping skills. This therapy can be used in psych nurse practice and can be applied in contemporary practice, as it aligns with not only nursing standards and their ethics of care, but also the policy and procedures underlying within the facility's mandate regarding safety and quality care. For instance, upon admission to the psychiatric unit at our practicum at KGH, I observed how the psychiatric nurse would instruct the person of what is expected and what is allowed and not allowed while in the ward. There will be self-control and skills training as some forms of exposure therapy. There are strict guidelines and expectations explained to the patient, and open and clear communication between each other is very stressed. It is very important to develop a good working relationship as soon as possible to avoid potential failure. This can be done through warm, respectful, supportive communication and understanding with each other. This strict form of therapy seems to instill the idea that substance misuse is not tolerated in the hopes that it will change the behavior through positive reinforcement and conditioning. I believe that incorporating different forms of behavior therapies like exposure therapy and aversion therapy, motivational interviewing, along with collaboration of care plan and strategies to improve the chances of success and self-control. I recall in our last clinical instances where I was able to work with a patient devising a care plan for what they would like to accomplish while in treatment, and when they had achieved their goals, they would be able to gain more privileges like fresh air breaks and certain personal items that were in storage, like a laptop or a cell phone. This was a form of reinforcement and reward for positive improvements in their behavior and self-management, thus training themselves to have a more positive and healthy behavior. Exposure therapy involves structure and complete client understanding and consent and clear guidelines and rationale explained. It is individually tailored to the client's needs and situation. Aversion therapy produces unpleasant consequences for undesirable behaviors. For example, if an individual consumes alcohol and abuse therapy, symptoms of severe nausea, vomiting, shortness of breath, palpitations, and headache would result, instead of the euphoric feeling normally experienced from the alcohol. The individual receives a punishment that is intended to extinguish that unacceptable behavior. Self-control training is used in substance misuse patients by helping the patient control their own behaviors and feelings about their misuse and what triggers them. With self-monitoring, the patient can identify certain cues that trigger the substance misuse and will encourage them to exercise self-control through self-reinforcements and a reward of some sort in a positive way. Keeping a daily journal and recording the problem behaviors will encourage and experience better self-control and awareness. When this happens, the patient is encouraged to reward themselves for doing something through self-reinforcement to gain more privileges for a job well done. And now we will, the groups will now reverse the positions and argue the opposite positions.
Okay.
Yeah.
So from what I gathered from my notes, I would say behavioral therapy is the best counseling approach to use with a substance misuse patient because the goal is to reinforce positive behaviors and eliminate negative ones. Behavioral therapy is used in substance abuse facilities, acute and long-term psychiatric facilities, private therapy, outpatient programs, and community rehab. With such a large spectrum of treatment areas and patients, behavioral therapy aligns with the method practiced by treatment centers, making it ideal to use with a substance misuse patient.
From what I gathered from Sasha, the goal of behavioral therapy is to reinforce desired behaviors and eliminate unwanted ones. You do this by reversing the bad behaviors. Rather than blaming the client, you're focusing on relearning behaviors, and it's reinforced with consequences, the positive consequences or the negative consequences, and it empowers the people to elicit that change. From Andrea noted that the program forced her to live in a nice home. No. The program forced me to change my behaviors by allowing you to live in a nice home. The only catch was staying clean. And you're able to change the negative behaviors, replacing it with positive ones, like being clean. And from Lorna, you spoke about specific exercises such as role-playing and breathing and relaxation, journal writing, modifications in behaviors like for your anger or fear or pain. And you talked about methods of doing this by calming yourselves and and repeating the behaviors. You ended up helping the patients develop coping skills through these different behaviors. So I can see how that would help with substance abuse.
After listening to Andrea and taking notes from everyone, I now believe that behavior therapy would be best suited for patients who misuse substances. Because as Andrea discussed, and Lorna, behaviors are learned, yet they can be unlearned, meaning that recovery is possible. With this being said, once behaviors are changed through therapy with the support of the therapist, family, friends, and significant others, the individual's feelings and thoughts will soon follow the behavioral change. And I believe that this is what needs to be done with people who misuse substances.
I also feel that the best counseling approach to the use of substance misuse in patients is behavioral therapy. And I found that the learning to unlearn is a good statement, thereby reversing the substance misuse thought process by developing positive reinforcement, or new coping skills of positive reinforcement.
Okay. From From my notes that I gathered, the best counseling approach to use with substance misuse is cognitive therapy because it focuses on the patient's feelings, thoughts, behaviors, and physiological responses, and then the therapist is then able to evaluate and concentrate on these self-defeating thoughts and behaviors which contribute to a person's low mood. Self-efficacy allows for a patient to have positive beliefs towards their coping skills and temptations, leading to recovery. In Jill's example of how she was able to overcome her addiction due to the fact that she became aware of the possible negative outcomes is a great example of how cognitive therapy works with substance misuse.
Okay, from my notes, I gathered that cognitive therapy is the best approach to use for substance misuse. What really stuck out for me was that people are disturbed by their view of things rather than the things themselves. And this sort of therapy focuses on feelings, thoughts, and psychological processes that are self-defeating and contribute to low mood. The ABC format is a good formula to break down and analyze an individual self-defeating thoughts. The A stands for the activating event, in this case, drug-seeking behavior or using substances. The B stands for the belief about the event, so that's where the self-defeating automatic thoughts come in. And C is the consequence of the action. And the onus is on the patient to learn new thinking patterns, but in collaboration with the therapist, they can develop better solutions, gain coping skills, alter thinking errors, and teach the patient to be their own personal therapist. So this would be more effective in the real world once therapy ends.
I believe cognitive therapy could be a great therapy for substance misuse as it focuses on how a patient feels, thinks, and behaves. It concentrates on their feelings, especially the negative and self-destructive ones. I like how it helps the patient understand the way the therapy benefits them. It gives them better self-awareness. And the fact that it's been around for like centuries, like it's been around a long time. So if it ain't broke, don't fix it, right? It focuses on the patient's feelings, like I said, and their responses. I like ABC's format, very easy to use. I thought that, ABC, and it's very simple. The onus is on the patient to change their living patterns. And what else did I have? Oh yeah, and Christina, like I said, he's talked about the history and the structure of the ABCs. Yeah, the awareness is awesome. Jill, I love your feedback on your experience with your child. Sometimes I love how that gave you that motivation, right? You need something. And how it involves the family and friends. You're never alone. There's always support, and there's people all around you the whole way. Yeah. That's it. Okay.